Okay, this is a video of the heart, the anatomy of the heart. So we're going to start off by identifying the superior vena cava there in green. And then below that we have the inferior vena cava in yellow. Okay. And then we have in light pink here we have the right ventricle, or I'm sorry, right atrium. Then below that in blue we have the right ventricle. And then we have on this side we have in green the left atrium. And then in orange the left ventricle. Up there in yellow we have the pulmonary trunk, which divides into the right and left pulmonary arteries. Okay, and then we have in hot pink we have the aorta. And then we're going to do the pulmonary veins. There's right and left ones in red. So there's the left pulmonary veins and the right pulmonary veins. Okay, and then here in teal, this is going to be, this whole structure here is your interventricular septum. It's dividing your different ventricles. So it's in between, ventricular, between your ventricles, and a septum is that structure that divides it. Okay, so let's open him up and talk about the structures inside. Okay, and as you can see, again, we still have the opening to the right atrium, the right ventricle, and there's the opening to the left atrium, and now the opening to the left ventricle. Okay, so on the right atrium we have the tricuspid valve, which is what the red pipe cleaner is going through. Okay, and the pencil too. In purple we have the Chordae Tendineae, which are all those little white strands. And down here in orange we have papillary muscles. The papillary muscles are what the Chordae Tendineae adhere to. And then up here in blue, we have the pulmonary semilunar valve. Okay, and now let's go to the other side of the heart, the left side of the heart. Okay, again, you have your left atrium. Okay, and what the green pipe cleaner is going through is the bicuspid or mitral valve. And again, in lavender there we have the Chordae Tendineae, which are the white strands, and in orange the papillary muscles, which the Chordae Tendineae adhere to. Okay, and then one more thing that I wanted to identify here is the interatrial septum. I'm going to zoom in here. It's just this wall. If you put your fingers through there, the wall that you feel, yeah, it's going to be your interatrial septum. So it's really hard to see. So basically, I guess if your teacher puts a pipe cleaner through there, that's what she's going for. Okay, and also, I don't think we identified the aortic semilunar valve, did we, on this side? Okay, on the left side of the heart, over here we have, let me zoom in. Oh, let me get a better picture. Yep, up there in red, we have the aortic semilunar valve. You can see how that would go off and into the aorta. Okay, so now we're going to identify the different coronary vessels and veins. So we have to piece them back together. Or at least the ventricles of them. Okay, so starting off on the right side of the heart, up here in red we have the right coronary vessel. And the left coronary vessel is right here in hot pink. It's actually just that that bulge right there. Yeah, it's not the whole thing because it's going to break off in yellow to the circumflex artery, which is going to wrap around. So the circumflex artery would wrap around up top following that vein. And then it breaks off in green into the anterior interventricular artery. So that structure, there's an anterior interventricular artery. Then we have in light pink there, we have the great cardiac vein, so that runs parallel to the interventricular artery. So there's a great cardiac vein. Okay, and over here on the right side of the heart, we have in yellow, we have the small cardiac vein right here. So there's your small cardiac vein. It actually wraps around the back, but the back of our heart is not complete, so we can't see that. And then I just want to identify the coronary sinus, and that's going to be back here in red. So see, you should have had structures back there, but we don't on this model. So there's your red, in red, your coronary sinus. So we could not identify the middle cardiac vein and the posterior interventricular artery.